enable. Do you see a video camera icon? Yes. Yeah. If so, click on that icon, and we are, and it says start my video.
Did you click on that to start your video?
Yep.
And what's it, is it doing anything?
We can see you fine and show the preview of us.
Do we click on the preview only? That's not doing anything either.
The start video, I'm sorry.
Okay, thank you. We're about 30 seconds from now. Okay, that's fine. They're just gonna have that person join us by phone.
Here's what we'll do, Patrice. This is Pat with the governor's office. We're just going to have you join us via phone. So don't worry about the video at all. We can hear you loud and clear, and everyone can. So we'll just do it then. Yeah. So the only thing you're going to want to do is mute your phone until you're ready to talk.
Okay, and then once I'm ready to talk, I hit the unmute.
Yes.
Okay.
Because you'll hear the governor introduce you.
And then I hit the button on mute.
Yep.
Okay. Okay.
Good morning. We'll go ahead and get started with the numbers this morning. So today we have 408 new positive cases for a total of 10,111 positive cases. And nearly 80% of today's positive cases are from the 22 counties where restrictions remain in place. And actually 261 of the 408 new positive cases are in Polk and Woodbury counties. There are 3,000 new negative cases for a total of 50,458. 60,569 total tests have been conducted in the state of Iowa. And on a per capita basis, that means about 1 in every 52 Iowans have been tested. We have 3,572 Iowans who have recovered for a recovery rate of 35%. Today, I am really sad to report that we have had an additional 19 deaths and Iowans who have passed away from COVID-19. We know that the virus causes the most serious illness for older adults and those with underlying health conditions. Iowa's deaths are consistently among this most vulnerable population. 56% of the deaths are residents of long-term care facilities. And despite the many, many proactive steps taken early on to protect our most vulnerable Iowans, preventing COVID-19 from impacting long-term care facilities is extremely challenging. We continue to work closely with our long-term care facilities across the state to test the staff and the residents. We're doing both diagnostic diagnostic and serology testing to ensure that they have adequate supply and proper use of PPE, and provide guidance on enhanced infection control measures. So we're going to continue to be proactive and work with our facilities across the state and do everything we can, just as they are, to make sure that we're protecting our most vulnerable during these very, very challenging times. For several days, I've also emphasized the importance of our expanding testing strategy to enable us to begin to phase in businesses and activities that were put on hold while we focused on mitigating the spread of the virus. Testing more Iowans provides us more information about the virus activity across the state, and it allows us to respond in a very targeted way to contain and manage the virus, especially in areas where activity is increasing or already high. As General Carell says, we're fishing where the fish are. So it's no wonder that our daily case counts have grown over the last few weeks. It's also important that we don't just focus on the number of positive cases, but also our hospital capacity and our ability to take care of Iowans that may need hospitalization. The fact is, we can't prevent people from getting the COVID-19 virus. If we weren't testing in these areas, people would still have the virus, and without being tested, diagnosed, and isolated, it could spread even further. So going where the virus is active and determining its scope within a region, county, or a community gives us a much better opportunity again to contain it and learn how we can manage it for the long term, so that life and business can continue to move forward safely and responsibly. As you know, Test Iowa is an additional tool that has allowed us to significantly expand testing across the state. And in 2 weeks since I announced this initiative, we've opened drive-through test sites in Des Moines and Waterloo. The third site is in Sioux City. It opened just yesterday. And the fourth will open on Thursday in Cedar Rapids. Again, we're prioritizing areas where virus activity is high so that we can target our response. So you can also help. If you live in or near communities with testing sites, take the assessment at testiowa.com to see if you should be tested. At this time, testing is prioritized for essential workers and those who are experiencing symptoms, have been in contact with someone who has the virus, or have traveled to an area where it's more widespread. More than 306,000 Iowans have taken the assessment. So if you haven't taken it yet, or if you've taken it but didn't qualify, just go to testiowa.com and click the Start button, the Start Now button. If you don't qualify at first, you can take the assessment again whenever your health changes to see if you would possibly qualify later. Another way that we're using Test Iowa is through our strike teams. So these teams of nurses are deployed to communities where virus activity again is high to conduct surveillance testing among employees who work in our long-term care facilities or manufacturing facilities. Again, by providing diagnostic and serology testing of these essential workers, we can identify and isolate positive cases and get them on a road to recovery, track virus activity, and ultimately create confidence in the safety of the work environment while protecting our most vulnerable populations. Since we started deploying the strike team, many counties have reached out for help, and while we remain focused on targeting communities where activity is increasing or already high, there are other ways that we can partner if there is a need. So Dubuque County is a great example, and Patrice Lambert is the executive director of the Dubuque County Health Department. She reached out to the Iowa Department of Public Health to ask for a strike team to come there. At that time, our strike teams were already committed, but Patrice was determined to make something happen, and together we found a way. So I've asked Patrice to join me today to tell us more about the effort to conduct surveillance testing of long-term care facilities and businesses in the community. Patrice?
Thank you, Governor Reynolds. I'm very pleased to join you today and speak on behalf of the Dubuque County Public Health Incident Management Team, which includes staff from Dubuque County Health Department, Dubuque County EMA, the City of Dubuque Health Services, and the Dubuque Visiting Nurse Association. We are so very grateful to you and your office, Governor Reynolds, as well as the Iowa Department of Public Health, for your support of our local targeting testing program, which will begin tomorrow. Partnerships are how Iowa will get through this pandemic, and this is a great example of local and state partners collaborating to address a challenge. When Dubuque County Long-Term Care Facility was identified with an outbreak on April 29th, the Dubuque County Emergency Operations Center and the Dubuque County Board of Health reached out to the Iowa Department of Public Health and your office, Governor, to request a strike team to come to Dubuque to test all residents and staff at that site. At the same time, we also started to experience an increase in positive cases elsewhere in the county, and the contact tracing conducted by the Dubuque Visiting Nurse Association identified a growing number of individuals who may have been exposed to those cases. For several weeks prior to these issues, our local public health officials had been working with our local healthcare providers to develop a plan for a community test site in case our local testing needs exceeded the capacity of our healthcare providers. Because of this local partnership, we had a plan in place for a test site, including the location, site logistics, and staffing support from local healthcare providers and the City of Dubuque and Dubuque County. With this plan in place and growing testing needs due to the first outbreak at our local long-term care facility and increasing positive case counts in the county, we contacted your office to request a Test Iowa site in Dubuque County. While the resources were not available for a state strike team or the Test Iowa program to come to Dubuque County, your office, Governor, and the Iowa Department of Public Health recognized that Dubuque County had a testing plan in place and critical local healthcare partners on board to work with the county public health team. We just needed testing supplies and test processing. Friday evening, we received word that the state could provide us with 1,000+ collection kits if we could conduct the testing program ourselves. Our local partners sprang into action, and by midday on Sunday, we had a plan in place to conduct a targeted testing program for all Dubuque County long-term care facility staff and individuals identified through contact tracing as having possible exposure to a positive COVID-19 patient in Dubuque County. The targeted testing planned for this week in Dubuque County is not open to the public. This is not a community testing program, nor is it related to the Test Iowa program, but it is enabling us to expand our local testing with special population. We will continue to work with the state officials to pursue community testing options for Dubuque County. And again, we are very grateful to our partners at the state level for the testing collection kits being provided to us so that we can test the at-risk population we have identified through contact tracing. Thanks again to staffing and logistical support from our local healthcare providers, our hospitals and community health center, Dubuque County and the City of Dubuque. We will begin our targeted testing program tomorrow and conclude on Friday. We hope this program can serve as a model for other counties and the state as we all look for ways to increase testing statewide while addressing the challenge of limited resources. Again, thank you, Governor Reynolds, and your staff and the Iowa Department of Public Health staff for providing Dubuque County with these testing supplies.
Oh, thank you, Patrice, and I am so impressed with what you've been able to coordinate locally and your efforts to really lean in, especially to identify essential workforce. I'm really happy that we were able to partner with you and your community, and I think it is a great example of how Iowans step up to help each other when there's a need. So thanks for your determination, and good luck, best of luck on the testing this week. As you know, we're also working closely with manufacturing facilities across the state to conduct the diagnostic and serology testing of employees to protect the essential workforce and keep critical business infrastructure operating. The Department of Public Health has been compiling data from those surveillance initiatives to be able to report outbreak status at facilities. So here to provide an update is Sarah Reister.
Good Good morning, and thank you, Governor Reynolds. Dr. Padati has determined that it is necessary to protect the public health to release the name of an employer when there's been an outbreak, which is defined as 10% absenteeism or 10% of a workforce as a confirmed case or as identified as a close contact in a single location of an employment setting, which constitutes a high-risk environment for the potential of COVID transmission, such as a congregate setting in which social distancing is impossible or impracticable, including but not limited to meatpacking plants, food and beverage processing plants, factories with production lines, and warehouses. At this time, the Iowa Department of Public Health has confirmed outbreaks meeting this definition in the following facilities. The Tyson plant in Columbus Junction, where we've identified 221 positive cases, and that represents 26% of the employees tested. Iowa Premium National Beef in Tama, we identified 258 positive cases, and that was 39% of the employees tested. The Tyson plant in Waterloo had 444 positive cases, and that was 17% of the employees tested. Tyson plant in Perry had 730 positive cases, which represents 58% of the employees tested. And TPI Composites in Newton had 131 positive cases, or 13% of its employees that were tested. We really do appreciate these employers working with the Department of Public Health to offer testing to their employees. Identification and isolation of ill employees helps prevent the spread of the virus within the community.
Thanks, Sarah. Throughout this pandemic, Iowa has benefited from federal funding to assist with a variety of critical needs. The latest is the Elementary and Secondary School Relief Fund to help schools contain unanticipated expenses that have resulted from their response efforts. So here to provide information is Director Lebo, the Director of the Department of Education. Ann?
Thank you, Governor Reynolds. Spring has brought some unexpected challenges, but I quickly learned that no challenge is too great for the administrators, teachers, and staff who work in our schools. In a short turnaround and with little time to prepare, they have engaged with students and families while simultaneously working to navigate this new learning environment we find ourselves in. Supporting equitable access to instruction for all students, purchasing educational technology, getting devices and Wi-Fi hotspots to students who need them, and providing professional development opportunities for educators and staff as they adjust to this sudden shift all come at a cost to our schools. Now we have financial relief to help. Iowa has received over $71.6 million in federal funding through the Elementary and Secondary Emergency School Relief Fund to help our schools address some of the costs incurred due to the COVID-19 pandemic. My team has been hard at work to develop and launch an application process so that we can quickly and efficiently get these critical funds to our schools. I'm happy to announce that schools can access the application today through the Consolidated Accountability and Support Application, or CASA system. They have until the close of business on Monday, May 11th to complete the application, and we have a virtual meeting today at 1:00 p.m. to discuss this process in more detail with school leaders. 90% of the $71.6 million will go directly to school districts, which will use a portion of the funds to provide services to non-public schools in their areas. The remaining funds will be used for state-level educational efforts to address urgent issues caused by the COVID-19 pandemic. Every one of Iowa's 327 school districts will receive an allocation of these funds to address COVID-19 related needs at their schools, including online learning support, professional development, educational technology, mental health services, and services to support students with disabilities. The list of allocations by school district and the allowable spending categories are available on the Iowa Department of Education's COVID-19 webpage. Districts can expect to receive their allocations on May 13th. The spending window for these funds is retroactive, going back to March 13th, 2020. Districts have to use the funds by September 30th, 2022. It seems fitting that this is also Teacher Appreciation Week as we provide this support to schools. There has never been a better time to recognize and thank our teachers for the work they do to educate our more than 554,000 students in school districts and non-public schools across the state. We've all had teachers who inspired us and even changed our lives. Saying thank you is a simple gesture, but it carries a powerful impact. I would like to recognize and thank a few teachers who have influenced my own life. My high school English teacher, Mrs. Hush, who was instrumental in my first public speaking appearance at graduation and my path to teaching English. Mrs. Murphy, who was a savior to me as a new teacher to the district and has been the same to my oldest daughter, who she now serves. Mrs. Lammers, one of my dearest childhood friends and most genuine and dedicated teachers I know. Mr. Lebo and the late Mrs. Lebo, my junior high teachers who taught me about rocks and writing, never expecting they would be my in-laws one day. And finally, my mom, Mrs. Rouse, or Miss Waltha, as her 5th grade students would recall, who has been my greatest gift of all. Now more than ever, it's the little things that matter. I encourage each of you to take the time to share your gratitude for the little things our teachers are doing every day that lead to the bigger things that life has to offer as part of each new tomorrow. Thank you.
Thanks, Ann. And since it's Teacher Appreciation Week, I also want to thank Iowa's amazing teachers, including one in particular who's very special to me, and that's my daughter. This has certainly been a challenging time. Under normal circumstances, you'd be preparing to celebrate your students' accomplishments as the school year nears an end. Today, I celebrate you and your dedication to making continuous learning possible for your students and their families now, and for being their champion when they finally return to learn. Thank you for all that you do to grow and develop Iowa's future. And with that, we'll go ahead and open it up for questions.
Governor, you mentioned the serology tests.
Yep.
Can you share what serology testing the state is using, considering the FDA has found that a lot of these tests aren't reliable?
Thank you, Carolyn. I don't have the exact specific on the test, but just like any other test, the serology testing that we are doing in the state has been validated by our state hygienic laboratory. So I would have to ask Dr. Pantella or Dr. Padati what the exact test is that they're using. But the tests that are being used have been validated, just like all of our other tests have been validated at the state hygienic lab.
Are serology?
And I think most times we're doing a diagnostics test along with a serology test, I think in a lot of the cases, so both are being conducted.
Are you including those serology totals in the total state total, or would you be willing to release those figures separately to know how many Iowans are getting these antibody tests?
I mean, yeah, we can give you that number. I've already said, I know I don't have the exact total number, but in some of the facilities that we've been testing, the processing facilities, we did 7,500, I think, and that was the diagnostic testing, and then we did 5,000 serology testing. So I do know that number, but I believe there's probably more that have been added to that. And then that wouldn't include, I do not believe, the number of serology tests that we've done at some of our long-term care facilities, especially with our staff. So Dr. Badati, she, at some point we'll bring her forward for this press conference, and she can talk about the study that she's been doing, and they're watching very closely what we're doing in the state of Iowa. So I think we'll have an opportunity to talk about that at some point in one of our press conferences, and she can give you an update on that, or Sarah, either one. I don't care who does that.
Can one of you guys explain the rationale behind the 10% threshold for businesses having to report an outbreak? Because obviously for larger employers that could mean upwards of hundreds of employees before they would need to report to the state. I know Iowans have raised concerns about that.
Yeah, thank you for your question. So the 10% figure is what we use when we're looking during our flu season. So it's a consistent standard that we apply as we're looking at flu activity throughout the state. And so we ask schools, for example, to report to the department when they have more than 10% of their students out ill. And so it's just building off of what we use for influenza surveillance.
Governor, the share of new cases each day has been growing in the 77 counties that where the restrictions loosened. It was around 5% early on. Today you said it's 20%. Do you have any concern that a greater share of the new cases are happening in those counties?
Well, we're going to continue to watch trends. We're going to continue to be proactive. So we're setting up additional test Iowa sites throughout the state so that we can get in front of it. But really what we're looking at is trends, and we're looking at virus activity. So with the data that we're able to collect, and with Iowans going online and using the assessment, that will give us some insight into maybe where it's happening. Is it in a community? Is it county-wise? Is it a facility? Is it a business? I mean, that allows us to really start to drill in and again get in front of it before we see a significant spike. And so we'll continue to look at the data and continue to manage, continue to be proactive in our surveillance testing so that we can identify and look at trends as we move forward. But we're looking at it on a daily basis. Still, the majority has been in the 22 counties. A lot of times when it's in a long-term care facility, I mean, they've done just about everything that they can do, and it's just really hard in that setting once it's exposed to contain it, regardless of everything that they've done to really try to prevent it. And so that's not indicative of probably a community spread, but more isolated to the long-term care facility. Would that be appropriate to say that?
I think that what we're finding. Yeah. I just think that, what we're finding here in Iowa is the same thing that we've seen in other states, is the virus spreads very quickly and efficiently in settings where people live and work closely together. And so we're seeing that trend, play out in Iowa as well.
Is that what you're saying? That's what's driving that increase in those 77 counties?
We're watching, and that's what we'll be able to tell by the data that we collect. But again, it's in households, it's in congregate settings, it's in manufacturing facilities where people work in close proximity. And so the more that we can identify, and that's why we've been proactive in doing the testing. I mean, we're working with our facilities to partner with them so that they can find out who's testing positive and who's testing negative, so that we can start to isolate them, do the case investigation, get them on a path to recovery, start to look at maybe separating shifts and really helping mitigate and control and manage the spread, and so we can have a better understanding of what the scope of the virus activity is. And so they've been really good partners in helping us really walk through that, so that they have some sense, and so their employees have some sense of confidence. Because again, the statistics show that 80% of Iowans will just have no or mild symptoms, much like flu. It's the 20% that we really need to be focused on, and those are older adults and those with underlying conditions. And so that helps provide, I think, some confidence to the employees to understand what that looks like in the facility and where they're at as they start to open back up and ramp back up.
Governor, some of the counties that are closed or with the stricter restrictions have fewer case counts than some of the counties that are open. Among those that are open, Potawatomi with 61 cases, 2 deaths. Crawford, 96 cases, 1 death. So can you explain what, if anything, goes into decisions about potentially closing some counties that are open, and why there's that discrepancy there?
Yeah, well, we're looking at trends, Caroline, not just a snapshot in time. And so we're trying to look at trends over time. And as you'll see, things are starting to even decline on the eastern side of the state because of when they entered into it and how they've kind of hit their, hit the peak, and now they're starting to trend down. And so that's some of the things that we will look at as we move forward. But again, because of the data and the way that we've moved into kind of the recovery phase of addressing COVID-19 and the coronavirus, is we can take a look from a county, from a community, right down to a zip code on where we're seeing the virus activity and how we respond to that. And that might not mean that we have to do anything different except for educate Iowans that this is what we're seeing in your community. You need to be more cautious. If you're a vulnerable Iowan, you most certainly need to continue to stay home. We have to remember that even in the 77 counties, we still have in place, you can't gather in groups larger than 10. That's still in place. Even with some of the businesses that are open, it's very restricted to what we have in place. It's 50% of the capacity. You have to social distance, so anytime you're out, you still should be social distancing of 6 feet. And so people need to be responsible. And I believe and I trust Iowans to do the right thing, and I trust our businesses to do the right thing, and we're actually seeing that. They're being really thoughtful about how they open back up. They're being very judicious in making sure that they're meeting all the guidance so that they can provide their customers and the people that they serve the confidence that they expect to come back in and to start to slowly open things up. So we can do it in a responsible and safe manner based on the data that we're doing. We're lucky to do that, and it's only going to get better. The more that we can test and understand and manage and contain, then we're going to start to open things up. But you know, you've heard me say 100 times, there's more than just the virus. There is the physical, there is the mental well-being, and there is the financial well-being too. Iowans are seeing their livelihoods just destroyed. And so we have to manage all of that. So you can't just look in isolation. You have to balance all of that when you're making decisions. And again, I believe in Iowans. I trust Iowans to do the right thing. There's going to be a few outliers. That's with anything. And together we're going to move through this, and we're going to start to reopen our economy. We're going to get Iowans back to work. We're going to get to the other side of this.
Would the state be willing to
I think I need to take some of your questions on. Appreciate you being here, but got other people that want to ask a few questions.
We'll clarify something. I haven't had a chance to ask something.
Yeah.
The figures you gave for the businesses you listed, does that include any serology results or just the diagnostic test?
It's just the diagnostic.
And
Oh, go ahead. Well, he's.
Good morning, Governor.
Hang on, we'll be right back.
Rachel, we'll be right
Got
back.
an active.
this last thing, does the relief money for schools, does that impact your thinking about budgeting for schools as you revise your budget plans?
Well, no, we'll sit down and take a look at that. So we haven't, I haven't done that yet. So we hopefully will try to do that this week or next week. But this goes directly to the schools to help them. Well, you want to talk about it? Just deal with some of the unexpected expenses that they've had to do with online and some of the other ways that they can deliver education. Do you have anything to add?
No, again, this is really designed to be relief because schools had to take on a lot of expanded and unexpected roles. So this first wave of funds is really to help support that. And I think there'll be continued conversations on whether there's a second wave of funding or how that's impacted by future funding decisions for schools.
Yeah.
Rachel, go ahead. Thank you for being patient.
Yeah. Good morning, Governor. What temperature are samples required to be stored at Test Iowa sites, and what's the process of keeping them chilled if that's required? And also, we've been getting numerous questions about opening campgrounds. Several people watching our stream today have asked again. So do you have a timeline on when those may be opened back up?
Yeah, we'll be making a decision this week, so stay tuned on that. And I'm not sure if I can get you that information. Pat can get that to you. They do have to be at a certain temperature, and they are. But I don't want to misspeak and give you inaccurate information, so we'll be happy to follow up with you on that question.
Next question, Dave Price, Channel 13.
Good morning, Governor. After Sarah has read off these businesses where there have been confirmed outbreaks now, can you assure Iowans that these companies took the proper precautions beforehand to make sure their employees were safe?
Well, again, sometimes this is household spread, sometimes it's community spread, sometimes it's congregate spread, spreading of the virus and the facility. So we've been in constant communication with the facilities to, talk about the procedures that they're putting in place to keep their employees safe. I'll be calling, I think I've got calls set up this afternoon or tomorrow again to visit with them to make sure that they have adequate PPE, that they're not running short on that. Most of the facilities, well, just all of them that I've had a chance to talk to have indicated that, they can't enter, the employees can't enter the facility without a mask. They're doing temperature scans. They're relieving some of the attendance policies. They're asking them to social distance. They're putting petitions in place. They're working, really diligently with their employees because they know it's so important to keep that workforce safe and healthy. And so and honestly, Jake, who is one of my is my ag policy team person, he's talking to them on a daily basis. So I touch base, every couple weeks, but he is talking to them almost on a daily basis. So we'll continue to work with the facilities, and we'll continue to do the testing so we can be a partner with that as well, and do everything that we can to keep this critical infrastructure up and moving, but most importantly, making sure that we're also taking care of that really essential and critical workforce that's standing on the front line to make sure that Iowans have food on the table. And so it's a partnership, and we're going to continue to work with them to make sure that that's happening.
We're going to go 2 more questions. Rod of the Gazette, go ahead.
Thank you, Governor. In looking at the health department's COVID-19 demographics, the largest group of Iowans with confirmed cases are in the 18 to 40 range. What's behind those numbers, and does it indicate younger people are taking this less seriously, or is something else at play there? And also, based on what the governor said earlier, is it believed that Iowa has peaked and now is in the recovery phase, especially in eastern Iowa?
I think, Rod, in terms of your question about high case counts in that particular age category, I think what that demonstrates is that, like I said earlier, I mean, the virus spreads quickly and efficiently in healthcare settings and in settings where people live and work closely together. And so I think what we're seeing is the results of some of our surveillance testing in those age category numbers. So I think we're testing people and working with these businesses to test people in long-term care facilities, to test people that might not even have symptoms that are showing up as positive cases. And so I think that's why we're seeing a spike in that particular age category.
Tony, Des Moines Register, that's the last question today.
Thanks. Good morning, Governor. Politico reported this morning that you're planning to visit the White House this week. What are your goals for that trip? How are you going to get there, and who is paying for the trip?
Yeah, so I'm actually going to be following several governors that have had an opportunity to sit down with the president, the vice president, and the team and talk about what they're doing in their states. I think Governor Cuomo, Murphy, Edwards, Governor Lee, and Governor DeSantis has gone before me. So I will be going to give them an update on what we're doing in Iowa and really talk about how testing and case investigation, our assessment, really working with our processing plants and how we've tried to be proactive in that respect to give him an update on that and to thank them for their assistance throughout the process. I'll be flying because it's kind of a last minute ask, and so we'll be taking a private flight out, but it'll be paid for with my campaign funds.
Thanks, everyone.
Thank you.